Hi, I'm Stuart of Core Elements Training. Today we're going to be demonstrating passive physiological rotation to the lumbar spine, grades 1 to 4. Okay, this is an excellent mobilisation to decrease pain and increase range of motion at the lumbar spine. Grade 1 and grade 2 are predominantly used to decrease pain. So in order to prepare the client needs to be in spinal rotation. So you're just going to hold their hand and glide their shoulder through. Okay, place the top hand on the bottom shoulder and then the bottom hand on the top shoulder. For grade 1 and grade 2, we're going to straighten the bottom leg. Okay. We're just going to hook the foot behind the knee. You're going to stand behind your client and stabilise the top hand because we don't want any movement from this part of the spine. Your other hand is just going to place behind the greater trochanter. Your direction of force is towards the knee. Now, we've got small amplitude movement here. Always do a test movement. Make sure your client is not in any discomfort. Okay, so grade 1 and then grade 2. To decrease pain. Okay. When we perform a grade 3 mobilisation, it's to reduce stiffness and increase range of motion. So we need to adjust the knee position. So bring the bottom knee in line with the top knee, both ankles together. Okay. So grade 3 mobilisation. So grade 3, okay, again, you're in a nice lunge position. Direction of force still remains the same towards the knee, hands just behind the greater trochanter, okay. Grade 3, you're in and out of range, okay, to decrease stiffness and increase range of motion. And then as long as there's no discomfort, you can perform a grade 4 mobilisation. And what we're going to do is just amend the position of the top leg so it's nice and straight. Grade 4, we're working at end of range, okay, so still stabilising the top of the body. You're working right at end of range, small amplitude movements. Again, we can perform these mobilisations 30 to 120 seconds, 1 to 6 sets, depending on what we're aiming to achieve, okay. So to recap, grade 1 and grade 2 are performed from this position. The top foot hooks just behind the leg, okay, decrease pain. Grade 3, we adjust the knees so that the knees and ankles are together. And we're working in and out of range, always for us in a nice lunge position, protecting our backs. And grade 4, at end of range, okay, small amplitude movement as long as there's no discomfort. These are great when used as part of a wider treatment and increase range of motion at the lumbar spine and decrease pain. So these lumbar mobilisations are excellent at decreasing pain and increasing range in the lumbar spine and will help all ranges of movement.